Clearing the Air, a prescription for life, where medical expertise meets mindful living. As an ENT facial plastic surgeon, I've helped countless of patients find relief from migraine headaches, sinus issues, and many more. Join me as we expand the conversation to encompass a full spectrum of wellness. I'm Dr. Kevin Smith with the podcast Clearing the Air, a prescription for life. And do I have a patient for you today? In case you didn't know, I'm an ear, nose, and throat facial plastic surgeon. I've discovered the root cause of migraine headaches, but I also do facial plastic surgery too, which includes rhinoplasties and facelifts and eyelids. But before we get into that, I know you're wondering, why is he wearing this Michigan cap? Well, this past weekend, my Michigan Wolverines defeated some team out of Ohio that we usually play this time of year. We had very little offense all year. It's been a down season for us. We're still the reigning national champions. I was a scholarship football player on the team from 78 to 81 out of the famed Dallas Carter High School, out of the movie Friday Night Lights and Carter High. So I just had to pay homage to my team by wearing my cap, and I'll wear it for this episode all the way through because we did the unexpected. We beat that team from Ohio 4 years in a row, and they spent $20 million on players, especially for this game this year. And we stepped into their house and defeated them 13-10. So go blue. Now, back to the podcast. So I have a patient, Leo, here. Leo is a patient of mine who just had his procedure some 10 days ago, I believe. And we're going to talk about Leo, what was going on beforehand, how he came to find me, and how he's feeling now. Because again, I'm all about helping people's quality of life, and he's the perfect example. Leo, thanks for coming.
Thank you for having me, doctor.
Well, let's start at the beginning. What were the problems you were having that were just nagging at you and affecting your quality of life?
There's a long list of things that were bothering me.
Let's hear them.
Well, my nose, first off, was drooping down.
Yes.
Which I was telling your nurse that one of my sons and nephews used to joke about it. They used to call me Squidward.
Oh,
they
yes.
They used to pull down their nose and call me Squidward.
Oh, okay. So it was pretty pronounced then, if they noticed it.
Yeah, it was pretty pronounced that children would notice it.
Yeah.
So now it's looking like a normal nose now to me. You can't really tell.
Good.
But one of the main things that was wrong with me was, I used to suffer from nasal drip, from nasal congestion. I could not breathe out of the right side of my nose, so it was only one side I was breathing out of.
How long was that going on? How long is it going on?
Man, and that's been going on for a long time, I was into martial arts.
Yes.
So I had my nose fractured a few times and never really got it completely repaired.
But you've seen several ENT doctors, right?
Yeah, I've seen several. This is the fourth time that I actually got it done.
Okay.
So
what actually made you continue with the symptoms if we hadn't finished that, and then tell me what then made you say, I need to go try this one more time with me?
The biggest thing that was the problematic for me was the embarrassment. I used to carry tissue in my pocket, and my nose was just constantly dripping like a faucet. I'd be talking to somebody, and I'd feel like Roscoe from Martin or something like that. It was just a nasty drip that was, like I said, embarrassing. So how I found you was I did some searching and research. I simply looked at my provider, and that led me to doing my own research. To find out how good different doctors were. And everybody has their own review, but I found good reviews, bad reviews, but you're gonna find bad in everything, right?
Yeah.
But the good reviews were the ones that really stood out to me, because I can feel the success that these patients had. When I walked into your office the first time and looked at the success stories that you had hanging on your wall, your own success stories of your own journey as a doctor, and how long you've been doing it. It made me feel like I was in the right place.
Well, that's good to know. That's good to know. Because you would think that you having had 4 or 3 other surgeries by other doctors on your nose, that you get to the point where you're just like, I'm just tired of this. But I guess you were tired of having the runny nose too and being embarrassed having to take these tissues around. I mean, that is an alteration of your quality of life, having to make sure I have tissues in my pocket. I don't know when my nose is going to start running. I have to wipe my nose all the time. I'm congested. I only breathe out on one side. And you were having headaches too, right?
Right. I was having headaches, different stuff, ringing in the ears. Um, it just affected a lot of my quality of life, my energy levels as well.
Mm.
So honestly, I feel like I can breathe like I've never breathed before in my life.
Well, let's talk
I
about.
can't remember. I can't remember breathing this good, to be honest.
He said that right after well, yesterday I saw him in the office, and it was his first post-operative visit after I straightened out his septum inside the nose. But I'll say I also, to help him with that droopy nose that he talked about, I had to get a piece of cadaver cartilage and insert it into his columella right here to help rotate that tip up, because he said, doc, when I push up on the tip of my nose, I breathe better. And I think this is a perfect example of what I do is I listen to patients, because just looking at you, I might not have made an inference to it or thought much about it. I saw it, but until you said it affects my breathing, I mean, the light bulb went off then. I'm like, oh, I can do something about that. And so that was part of it. And in addition to the exam, we also had the CT scan that I took and reviewed at the same time. And I showed you what the abnormalities were inside your nose, talked to you about what I needed to do to correct those. But then it wasn't till the morning of surgery, though, that he reminded me that I was like his fourth surgeon going to do this surgery. And I had planned on lifting that nasal tip, and talked about using some cartilage from his septum if he had some, or use some from his ear. But as he began to talk again, I had to listen, and I was listening, and I said, no, he's not going to have enough cartilage in his nose. And then the cartilage on the ear is going to be too weak to really hold up to a nose that's been operated on 3-4 times. And so the light bulb went off, and I said, would you mind if I use some cadaver cartilage? And I'll be honest, I've never used cadaver cartilage. I've been doing this 30 years. I've never used cadaver cartilage in anybody. So you're the number one person and only person to the date that has had that. But it came to me because I knew that was part of my repertoire that I had available to use. And you said, sure. And it made the surgery so much easier. I mean, I got in there, and I could see the scar tissue from the nose and the old sutures that you had from your previous surgeries. And I removed that, and I made a little pocket to put the cartilage in, and I cut it to size and measured it, and I put it in the pocket, and I tucked it underneath the dome, and it just rose up like it was supposed to. And I sewed the incision back together, and that was it. Put your splints inside the nose. So everything went as planned. And so when he came in yesterday and I take the splints out of your nose and off the nose, you immediately said, wow.
Yeah, it was amazing.
You said, I've never breathed. You said, I don't think I ever breathed this well when I was a kid.
Yeah, if I did, I didn't remember it.
Right, right.
Yeah.
So then it's been 24 hours since I took the splints out. What are the differences in the symptoms and things that you're experiencing now?
It's like I keep feeling like it's my nose is gonna get clogged up again. Like I can't believe that I'm breathing this good, actually,
Okay.
honestly. So like the symptoms that I'm feeling, um, I'm not feeling any symptoms
Mm-hmm.
anymore.
Mm-hmm. The,
There's
the breathing's
little
better.
the breathing's better. I mean, there's a little bit of soreness still from the operation. It's still fresh,
Right.
but for the most part, I feel like I'm a new man, honestly.
Mm-hmm.
So,
So the kids don't get to tease you anymore.
no, yeah, no more teasing from the kids.
You don't
Yeah,
you don't have that drainage you used to have.
right.
Are your ear symptoms better?
Everything's better. And
Everything's better.
my ear symptoms are better. My runny nose is better. Um, no more headaches. I haven't felt anything like that before. And like you said, this was the fourth time um, that I had this procedure. Everything about this procedure was different, though.
Well, let's talk about that then,
Yeah.
because you had a lot to say about the office, about the procedure, about the follow-up care. Just let's go into that. What was it about my office that was different from everything else that you've experienced?
Out of all the other offices, nobody ever was attentive as much as your office was to me. Your office was there to guide me to aftercare, to pre-care, and even during aftercare, I had a little incident where some packing came out that worried me. I was able to call one of your nurses 24/7, 9 o'clock at night. who got a hold of you and got the information that I needed, then that everything was okay, everything was fine. Don't worry about it. Everything's normal. But yeah, the biggest thing was the way that you instructed me to take care of my nose, the cleanliness that you prescribed for me. It was nothing that I ever received before.
Yeah, I
Yeah.
heard you hadn't had any really instructions on how to care for the nose afterwards. It's very important that we have our patients irrigate the nose with saline because it keeps it moist, it keeps it clean, it keeps the blood that might be building up or draining from building up in the nose, which makes you feel better because you're not as stuffy as you probably could be if you didn't do that. And then we have them use a little peroxide on Q-tips to keep the little crust at bay in the front of the nose and keep antibiotic ointment on the incisions. And you had an incision across your columella, the little part
Right.
between the nostrils that you had to keep ointment on and keep peroxide to keep that cleaned. So we do take pride in making sure that everything is done properly so that you get the best outcome that you can get. And so I'm glad that you appreciated that. And I'm glad we could be of service and to make the post-operative course smooth, I guess
Yeah.
you could say, and reassuring. We make it a point to call our patients the first 3 days or so after surgery just to make sure that everything's going well, to see if you have any questions, if you have any problems or things like that. And then we always have a 24-hour line that you get to call in case you had questions like your little packing coming out. And I remember getting the photograph of that. And I said, oh, yeah, that's just the packing. It's dissolvable. So it shouldn't be a problem. And we got that word back to you, which again, I guess reassures you in knowing, okay, that's fine. I'm doing my rinses good. I must be doing my rinses well
Right.
if I rinsed out the packing, right? So, yeah, well, that's good. Um, what else? What else do you want to expound on?
Just the fact that you were there too.
Mhm.
You reached out to me immediately after the operation. You didn't get a hold of me, but you left a very beautiful voicemail that showed me that you cared about me.
Mhm. Mhm.
No other doctor that I had did that. And the last doctor that I had, I don't even know if I could still get a hold of her. It's crazy, and she's over here in Houston too. At the big medical center.
Mm.
So yeah, it's just mind blowing, honestly, the
Mhm.
care that I got from you. So I'm really appreciative of it. I've told everybody about it. From my mom to my wife to I've already referred my ex spouse to you. She deals with migraines herself,
Okay.
and I've already sent her your information and said, hey, you need
Wow.
to go see this guy.
Well, good. Well,
Yeah,
that's very honorable of you.
yeah,
But I can tell you're a very caring person, and you're a very appreciative person.
right.
And that's why when you said what you said yesterday after doing this, I said I have to have him on the podcast so we can just talk about his experience because it seems like he's had a really unique experience, which you have, to have had 3 other surgeries and to be able to contrast the treatment that you got in my office compared to the treatment you got with other offices. I thought it would be good for people to know. That way they sort of know what to expect and how it should be when you go see a doctor. You want somebody and you want the whole staff to care and to really be into it. One thing about us at my office, I tell you, we help so many people feel so much better that we're all in as far as how much we care about patients because we see you when you're devastated and you're coming in and you're deflated and you're having these symptoms and you're not sure, is he going to be able to do anything for me? This is my third, fourth time. I mean, I've been an ENT. I did all my research. I hope he lives up to the hype. And, uh, and then we see the transition afterward and it brings so much joy because that's what I do. That's my whole livelihood is helping people feel better and look better. In your case, my website says to look your best and feel your best. And in your case, it's both
Right.
because now your nose looks normal. You said that even the little thing about shaving, you didn't have to lift your tip of your nose up to shave underneath your nose anymore.
Right. Yeah.
I mean, those are little things that you don't think are big things, but if somebody has to do that every day, it's a nuisance,
It's a
right?
nuisance.
It's just a nuisance that you just don't want to do. And so the fact that I can curtail all of those things um, and just allow you to just live your life the way it's meant to be lived and put all of those things behind you, it's a joy. It's a joy. And I don't think a lot of people understand, which is why I call this podcast Clearing the Air. I like to educate people on exactly what they should expect with things like this but also understanding when you have nasal airway obstruction. I'll just elaborate on that a bit right now. When you don't breathe well through your nose makes nitric oxide, which is a potent vasodilator. And when you inspire, a normal nose will inspire and that air and get that gas, nitric oxide, to go into the lungs and then into the bloodstream, and it dilates blood vessels, so you get more blood flow to the brain, to the organs, to the muscles. That's how it's supposed to happen. There have been some studies that have mentioned that in young adults and kids who are mouth breathers, they don't get that benefit, and as a result, they're at a higher risk for heart attack and stroke because those vessels stay constricted instead of getting dilated fully. So there's some mechanism of action that takes place. It's not just I can't breathe through my nose. There's some physiological issues that can go along with that people don't understand. But in addition to that, when you don't breathe well through your nose, it can lead to a host of problems. And he's a perfect example of that. You can have chronic runny nose. You can have postnasal drainage. You can have chronic headaches and or migraines. You can have chronic sinusitis, and you had sinusitis as well seen on your CT scan because the airflow is not optimized and you're not clearing the secretions. So the mucus builds up in the sinuses, the bacteria then builds up because the mucus builds up, and you get sinus infections over and over and over again. And then you have the ear symptoms. You know, the eustachian tube opens up behind the nose. And in order for it to function properly, you have to have proper airflow. When you don't, people who fly on airplanes and when they land, they can have trouble trying to clear their ears. People who scuba dive are going to have problems. People who mountain climb are going to have problems going into high altitudes and then coming down because they can't equilibrate that pressure in their middle ear to the atmospheric pressure on the outside. And you get intermittent muffled hearing. You can get intermittent dizziness. You can get intermittent ringing in your ears, all because your nose is not properly functioning. And so what I do as an ear, nose, and throat surgeon, it's my job to perform my procedure. My Smith sinus migraine technique is what I call it. And it's a highly specialized technique that allows me to optimize or normalize the nose, which allows the airflow to be proper, which allows all those other things to go away. And Leo, you are a perfect example of when you do that, all those things just resolve.
Right. You hit it on the head when you were saying about me being a little bit skeptical walking in the office, you know,
Let's talk about that.
and my energy levels kind of being kind of low and just, you know, I just want to see if it was like you said, see if the hype lives up to
Mm-hmm.
all the stuff I read about.
Right, right.
But I know you can tell my energy level was completely different whenever I came in there after my operation because even during the recovery process, I could already tell I was breathing better
With
than
the
I with
with,
all the
with the
stuff
splints in.
with all the
Wow.
splints and all the stuff in my nose. I still
You s-
breathe better, and it was amazing. Yeah, I wasn't sure there was splints in there,
Mhm.
so
That's incredible. Yeah, yeah, you had splints in there. I needed
yeah,
that to kind of stabilize the septum
yeah,
after I fixed it. I don't always use them, but when I need to, I have to. And you could already tell. That's pretty incredible.
yeah.
Yeah. You know, one thing I've noticed is you're smiling a lot more. You know, when you first came in, again, and I can understand that, putting yourself in the patient's shoes, you're like, one more doctor. Okay, let's hear what he has to say. But since then, man, I tell you, just been smiling. Your eyes are brighter. You're happier. Are you sleeping any better? Do you ever have any problems sleeping? Because that can sometimes be a problem when you don't breathe well through your nose. Were you having any issues with that? Or
I believe I was having problems sleeping as well, you know, because I was dealing with congestion where I would have to clear my sinuses, like sucking it back
mm-hmm.
and different stuff like that. Nasal drip in the back of your throat and phlegm just build up. So it was constant, you
Yeah.
know, it wasn't a seasonal thing. It was year. It was all through the year pretty much, you
Well,
know?
how many years did you have these symptoms? We didn't
Yeah.
say that. Let's take your time.
It's been several years, you know. I actually got my first operation when I was 13, you know,
Oh,
because I was
really?
born with a deviated septum.
I see.
So, um, they did the operation,
Hmm.
but like I said, I was into martial arts, so I maybe waited for about a year and then went at it.
Yeah.
And so that probably wasn't enough, honestly, for it to completely heal to its strength to withstand punches and all that hard stuff that it was put
Hmm.
under. But and I dealt with that for a long time, before I got my second one. I didn't get that until I was well into my 30s. I dealt with that for a long time, and honestly, that procedure didn't feel like it helped it at all.
Oh,
It
so
didn't.
you went through a procedure and you feel like I don't feel any different.
Yeah, I didn't feel like there was no difference. It didn't feel any better. It maybe
Oh.
looked a little better, but it didn't feel better. You
Hmm.
know, and that's what really mattered was how it felt.
Right. Right. I think you're hitting on a very good point. I perform rhinoplasties like I did with you to change the outside appearance of the nose. But as an ear, nose, and throat doctor, it's very important. I always say this: it's very important that I examine the inside of the nose to make sure that it's normal too, because you can have a beautiful nose on the outside, but if you can't breathe through it, that's going to be a problem. So I'm always looking to see, is there something I need to fix on the inside? So both it's functioning well and it's looking beautiful.
Yep.
So and that's what I do. So I'll just address each problem as I see it, to make sure that everything is just optimized and normalized. Yeah. Yeah. So you've been dealing with this for a while.
Long time, doc. A long time.
And I'm
Yeah.
sure there are millions of people just like you who think it's normal, maybe even to be congested, because all you know is your breathing is the only breathing you know about, and you think that's normal. I guess some people have told me that, but it isn't normal to have a runny nose every day. It isn't normal to have recurrent sinus infections. It isn't normal to have chronic recurrent headaches, just nagging headaches that even some people might say, well, they aren't that bad. I just get them maybe once or twice a week. That's not normal. And especially if they progress onto migraines, migraines, no matter how infrequent they are, that's not normal. And I always say that a normal nose typically won't give you chronic symptoms. So when you have somebody with these chronic symptoms, there's usually an anatomical explanation as the cause. And so as an ENT, I'm like a detective. You come in, you start complaining, I'm reading over your history, I'm looking at your CAT scan, and I'm looking at them saying, okay, before I even saw you, what I do is I'll look at the scan while my medical assistant's talking and getting the information. But I already had the questionnaire. So I have the questionnaire, I have my CT scan. And by the way, we scan people in the office. It's very convenient. You come in, it's a one-stop shop. You come in, you get your exam, you get your CT scan. I review the CT scan with you. I talk about the procedure that needs to be done or procedures. I will then answer any questions that you have regarding that. I'll talk about the risk of surgery. And then from there, you go and talk to the scheduler. And this is on the first day.
That was the first scan that I got, and as well out of all the three. Like when I first saw my CT scan, I was like, "What's this?" He started showing me everything inside of my nose. I was like, "Wow,
Yeah.
that's what's
Yeah.
going on in there."
That's what's going on. And what it does, it makes you understand that there's a lot of problems in there, but it's okay. I can fix those problems. And so um, it's something we pride ourselves on and be very efficient. And I love having my scanner in the office. It allows me to, again, educate you so that now you're more comfortable. You're not just depending on what I'm telling you I saw. We actually go over it together and you understand and can talk to your spouse or your family and friends about, no, here's what he showed me. And oftentimes I will even let patients take photographs of the scan so that when they go home, they can talk to their spouses or family or friends and let them know, no, this is what he said I need, and this is why I need it. And so everything's above board and out there uh, to be understood. Um, well, what else do you want to say, my friend? What else do you have to say to the folks out there who are feeling like you felt?
I wasn't the only one that was tired of getting my nose done because you have to have someone that takes care of you.
That's true.
My wife was tired of this too. She wasn't all on board at first.
Let me hear about that. So
Yeah,
what discussions did you all have about it? So you started thinking, look, honey, I got to do something about this. I'm tired of these tissues. I'm tired of these headaches. I guess that's
yeah.
how it went.
Exactly. I'm tired of it. I'm tired of running nose. I'm tired of having just mucus. I just feel like a blob, like
Okay.
and
All right.
and the CT scans is what helped. I was able to take pictures of the CT scans, and I was able to go home, show my wife,
What'd she say?
and she could understand. You can see it plain as day what was wrong inside my nose. My turbines were extremely
Huge.
huge.
They were
You know,
huge.
yeah, I had no room. I had no room to breathe in there.
That's right.
Yeah.
So once she saw that, then I guess she was like, oh, okay, well, I guess so. Let's do it.
Yeah, let's do it. This is because that was the first time she's seen that as well. She was with me for the last two operations. So she knew exactly what it took to take care of me and what I was going to go through. She didn't want to see me go through that pain again.
Right.
It's a big recovery
It
process.
is. It is.
Yeah.
Was yours painful? And be honest, was it a pain? How would you describe the discomfort, pain, or whatever? How would you describe after
Honestly,
the surgery?
this was a lot more comforting than the last operations. Like I said, out of the operation, I was able to breathe immediately. I didn't feel like my nose was congested or clogged. The other operations felt like my nose was constantly caked through the whole recovery process. You know, they prescribed me some minor saline stuff, but not the kind of wash that you
Yeah,
the
the
Nelly,
irrigation. Yeah, the
irrigation.
Neil Med,
Neomed, oh my gosh, that was the key right
lifesaver.
there.
It is a key
Yeah.
because, the thing is, the nose, like anything else, when you trim it and it heals, it's going to make scab and it's going to have secretions that are going to be released because it's healing. And those secretions can get really thick and then they can get hard and brittle and they can cause problems. But if you start out early and you're doing your irrigations, and we have people do them 4 to 6 times a day for that first week, because we understand that tissues in the nose heal faster when it's in a moist environment. We have them take Mucinex, which promotes mucus. We give you antibiotics. We give you steroids to help with the inflammation and the swelling. And so there are a lot of little different things that we do, but we have a reason for doing it because, in the end, it's going to help you get through that recovery process and be on your way to living a normal life.
Yeah, I thought I knew how to take care of it, honestly. If I didn't read those post-op stuff, because like I said, I've been through this 3 times
Right.
before, I know what to do. I know how to take care of this. But no, your prescription for taking care of it was completely different than all 3 of them.
You had an encyclopedia that you had to
all
read
3.
and you had to memorize, right?
Yeah.
But you appreciated that.
Oh, I did. Yeah. And I
That's-
was very thorough about taking care of it. I washed it out probably more than 6 times a day.
Oh, okay.
Just to make sure that whenever it was clean, the prescription said at least 6. So
Mhm.
I went ahead
You
and
even did more.
did a little bit more.
Good, good. Well, that's why you look so good. When I took out your splints, I joke with my patients, we probably did it with him too. Sometimes the splints come out so clean. I said, I can use these tomorrow on the next patient. They're so clean. But no, and they will look nice and clean when you've done your job. And I can tell, I can usually tell when people are doing what they're supposed to do and if they're not. Well, look, Leo, I want to thank you very much for coming on the podcast, Clearing the Air, a Prescription for Life. Is there any last prescription for life you'd like to throw out there to the listening audience?
I mean, take a chance. If you're having nasal problems and this is what your issue is, and from migraines to anything, go see a doctor like this. Go see my guy, Mr. Smith here.
Come go see me. That's
Yeah,
right.
go see Mr. Smith here. Yeah.
We'll take good care of you.
Yeah, like I said, I've seen 3 other doctors. Don't just go see a doctor. Go see this doctor.
There we go. That's what we want. That's what we want. Right. Yeah, he's done all the research for you and everything. So I would say, I'm pretty astute about, looking at the scans, and I've developed my highly technical Smith sinus migraine technique that I've been perfecting over the years. And it's done wonderful, and you're a testament to that. I want to thank you again for coming on the show and sharing your story. I think it's going to be very meaningful for a lot of people out there. And I wish you a wonderful life, my friend. You go out and live life to the fullest, okay?
Thank you, Doc.
All right, thank you.
Thank you for having me.
That's it for today. Until next time, stay curious, stay healthy, and keep shining. Don't miss out on our next episode of Clearing the Air, a Prescription for Life, packed with more conversations that matter. Be sure to subscribe and share with those you love.